So we have a repeat patient, and she's originally from
Pune.
Nah,
From Mumbai, but shifted to Pune.
she forgot. पहले जब आए थे, what was the issue like?
I had a slip disc issue in the middle back
And?
upper back and neck.
Correct. But this time you came with
Just for one-sided in a
correct, which is a low back left sacroiliac joint issue. But why is this happening? Let us see the x-ray and then we'll come to know. But before that, let's ask our patent question. So when you first saw me, on that day, 10 में कितना पेन था आपका?
On the first day, it was 100% pain. Then initially on the first treatment only, I got a 70% result.
Correct, correct. So because she's a working lady, she's obviously working for about approximately 8-10 hours a day.
Yes.
So sitting mostly,
Yes.
and since it's a sedentary kind of lifestyle, she has a little bit of dysfunction in the sacroiliac joint. First, let us see what the issue is like, and फिर हम treat करते हैं. आइए. तो ये हमारा whole spine DXR है, यानी digital X-ray. उसमें अगर आप AP view देखोगे, and especially she has a pain right over here, the problem is not only just over here but also on the right side. If you see, right wala iliac crest is on the higher side compared to the left wala. So right like this, see how much high it is. तो हम इसको नीचे करेंगे, and then this we have to pull it up with the help of quadratus lumborum muscle to balance the pelvic. So let's see how chiropractic and osteopathic concepts help her to get rid of her sacroiliac joint pain. First, mobilize the sacrum, do a little bit of sacrum rocking, and then we do a little bit of sacral traction or stretch. Now we will change hand position on the sacral sulcus and sacral base and reset the left SI joint. Start. SI joint. So for any sacroiliac joint pain, what I always do is clear the inguinal ligament and then the iliopsoas muscle. First now, I will do osteopathic technique on the ilioinguinal ligament. Hold it for roughly, depending on the tightness and depending on the give, it may vary between 30 to 90 seconds. So that's what I will be doing. Apply a little bit of more pressure. Right now, there you go. I felt that stretch and I will back it off. 3, 2, 1. Perfect. Next आते हैं हम iliopsoas. उसको release करना है because iliopsoas is a muscle which is in front of the vertebral column. Again, we'll hold it roughly between 30 and 90 seconds depending on how much the muscle is giving me a little bit of way. I think we are good with what I am feeling. It is pain, but it's a blunt type of heavy feeling that you are having, isn't it? Right. So it's more of a discomfort. 3, 2, 1. Perfect. 3, 2, 1. One more time. We also treat the knee joint because left side agar hai, तो this hip joint and knee joint needs to be treated. In fact, I will also treat the ankle joint. So there you go. Whoa. थोड़ा सा राइट साइड जैसे हम एक्सरे में देखे थोड़ा सा ऊपर है, तो इसको हम डिस्ट्रैक्ट करके सिमिलर लाने का कोशिश करेंगे. वो बैम, लुक एट इट, परफेक्ट. अभी एंकल वाला करना है, तो देयर यू गो. दैट वाज अ स्वीट crackalicious crack. Oh, ho, 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 ho. Done. We'll do a J slip that will help me release the entire lower limb. तो कुछ कॉन्सेप्ट्स ऐसा है कि अगर कमर में दर्द है, if you treat higher level of cervical spine or the cervical spine instead, that helps to loosen the erector spinae muscles. Just rest your head on my hand.
Oh.
सर के ऊपर हाथ रखिए, ढीला छोड़िएगा. All right, relax. Take a long deep breath and relax. Done. Again, keep your knees squished. Take a long deep breath. Relax. Done. That was awesome. We'll do the other side. 3, 2, 1. Done. Long deep breath and relax. It was wonderful. Okay, hug yourself. There you go. 3, 2, 1. Oh man. Okay, that's wonderful. ये up and down कीजिए, left वाला. So currently मैं sacroiliac joint reset कर रहा हूँ, this right over here, and फिर धीरे धीरे quadratus lumborum के पास जा रहा हूँ. This helps again to relieve the muscle spasm, tightness, जो भी है. ये पहले ये पैर उठाइए ऊपर. Okay. Next ये वाला पैर ये नीचे रख के. Higher, higher, higher. That's what we call magic with these two things. So, as you all know, we love to do test, treat and retest. That's what exactly she will be doing. She'll be trying to touch the toes with her hands. पहले तो करने के लिए बहुत दिक्कत हो रही थी, दर्द हो रही थी, तो इसीलिए वो कर नहीं पाती थी. अभी देखते हैं. Super duper? Yes. Yes. And you can see from the smile that I don't need to tell you the story. तो कैसा है क्या? So if you have any issues or your friend, family members, relatives have any issues, certainly do share the number. Number is in the description box or in the at the end of the video. Take a look, and we are in Kolkata. We have multiple clinics in Kolkata, and as you can see, we have patients coming from all over India and the rest of the world too. So do not wait for the pain to go. Let us help you, and so that you can live a pain-free life. Isn't it so?